This is the cervical extension screening tool for neck and arm pain. The first step is to set a provocative baseline that they can do in front of you. For neck pain, this might be turning their head from one side to the other. For shoulder pain, this might be lifting their arm up over their head. Or for isolated elbow pain, you could use the classic resisted tennis elbow tests. You're going to retest this painful baseline immediately after 10 to 30 repetitions of this screen to see if there has been a significant change in their pain or their range of motion or both. Have the patient seated in a chair with a back for support. Sit all the way back in the chair. First, show the patient the exercise and tell them that there are two components. There's a retraction component, which you're seeing right now, and an extension component, which is after retraction. For the retraction part, have them slide their head backwards, as you can see in the video, and make sure to tell them they're not lifting, they're not tilting their head up, they're not tilting their head down. It's a straight slide backwards as far back as tolerable. The second component is extending from that retracted position as far back as possible and then coming right back up into neutral. A key component to this exercise is making sure they get as far back as possible with that retraction component and as far back as possible with that extension component. Have them repeat this 10 to 30 repetitions depending on their tolerance level. Now, if they cannot tolerate this because of a high level of pain, dizziness, or lightheadedness, then you can have them try dampened cervical extensions with a towel around their neck or the hands behind their neck, as you see the individual doing this in the video right now. If there is a decrease in pain or improvement in range of motion or both with your provocative baseline that you set before you started doing this repeated movement exam, tell the patient that this gives you some evidence that they have one of these very simple fence post type joint problems that could be rapidly reversible with this particular exercise. Then you send them away with 10 repetitions of this exercise every 1 to 2 hours for the next 72 hours. Make sure you tell them it is not a life sentence, because once the dirt that is around the fence post has loosened up and softened, the fence post can actually come out of the ground. The joint can restore normal, healthy range of motion, which then reduces the pain intensity that can have lasting improvement if they just maintain a very simple once per day preventative prophylactic exercise program using this particular exercise. In fact, they don't actually have to do it once a day after their pain fully resolves. They can get away with doing it 3, 4, 5 times per week, but usually they need to do this on a regular basis afterwards for some level of maintenance to prevent recurrence based on the fact that they're probably sitting too much and probably bending forward too much. You now have the option to see that patient again in 1 to 2 weeks to see how they're doing. And if they are better, you continue to encourage them to do that exercise on a regular basis. If they are not any better, you can refer them to an MDT certified and trained clinician within the community. You can simply Google McKenzie Institute and then the country that you're in, and that will take you to the country's McKenzie website where you can find a provider that is trained and certified in mechanical diagnosis and therapy. Or you could go to disruptionmsk.com where we have MDT certified providers that are highly trained to deliver this type of care online very effectively, get to an accurate diagnosis, and get people on a proper self-management program that can help them understand their problem and resolve their pain in 92% of cases without any hands-on care. And that's it. You're ready to go with this screening exercise. Now, I challenge you for the next 5 patients that you see that come into your clinic with either neck pain, shoulder pain, elbow pain, even wrist pain, to do a very thorough screening test for the cervical spine, and you'll be amazed at how many times you will see this phenomenon of extremity pain of spinal source when there's isolated wrist, elbow, or shoulder pain. You'll be amazed at how many people will respond very positively to this cervical extension type of movement if they have neck pain. All right, I'll see you in the next video where I talk about lumbar spine pain and leg symptoms.